Come in.
Hi, my name is Sydney. I'm going to be your nurse today. You're Henry, right?
Yes.
Awesome. Would you mind confirming your name and date of birth for me?
Henry Williams. My date of birth is September 9th, 1998.
Beautiful. All right. So you're here today for your 2-week follow-up appointment after you had infective endocarditis, right?
Yes.
Okay. So today I have some material that I'm going to go over with you, just so you can get a better idea of how oral health can affect your heart health, just because you have that history of the rheumatic disease.
Mm-hmm.
All right, so I'm going to start going over with you, and you just let me know if you have any questions.
All right.
So it's just kind of a quick slideshow, and we're going to establish some patient goals today. I want you to be able to teach back to me the skills you learn, but I'm going to teach you why oral health affects your heart health. We're going to master our proper flossing techniques and establish a daily oral care routine that protects your heart. And this is mostly specific to you, these particular information, because you have the history of rheumatic heart disease, which means your heart's more valuable to bacteria that can be in your mouth. And it's not that you don't already have good oral health, it's just that you are more prone to infection. So having a really well-established routine can prevent infections. And another reason that you might need an alternative oral health care routine is because you do have that permanent retainer that can cause more plaque buildup because it's just a little harder to get. Alright, so oral bacteria affects your heart in several different ways, and because the kind that you were diagnosed with is the Viridin streptococcal bacteria, that specifically originates in the oral mucosa. Other ways that bacteria can affect your heart is through the bloodstream. Like if you're going to get dental work, a lot of times antibody prophylaxis is recommended, where they give you a dose of oral antibiotics. So if you plan on having your wisdom teeth taken out or something, that might be something that you do to prevent another bacterial infection.
Mm-hmm.
Some of the risk factors, we've already gone over that you have the rheumatic heart disease and that you've previously now had infective endocarditis. It makes it more likely to have again. Because of the rheumatic heart disease, you classify as immunocompromised, and on the slide it says poor oral hygiene. We just need a more established oral hygiene routine. And there's, fun fact, research shows that participants with higher plaque index have higher incidences of bacteria that cause infective endocarditis. So for flossing with your permanent retainer, there's a couple different options. I don't know if you have a water pick at home, but those are easy to use. It's not the most effective method to use, but if you use that daily and then every once in a while really get in and do a good floss job, a lot of dentists recommend that. There's something called the floss threader that it's just like threading a needle, and you get behind the retainer and you can floss as normal once you get behind there. It's a little more time consuming, but it does a really good job. And there's also interdental brushes. You can use those and poke them in between the gaps in your teeth, and it makes it a lot easier. You can bring them on the go. And so in order to use the floss threader, I brought a couple with us today that I'll have you demonstrate. But there's the hardened part that helps you get behind that retainer, and then the rest is normal floss. Do you know how to floss? I'm sure you've been to the dentist and they've told you a million times.
Not with these though.
Sure. So I'm going to go over a step-by-step guide real quick. So after you've chosen your floss, you're going to gently glide that floss under the retainer wire.
Okay.
And then once you get under there, you floss in a C motion. So you kind of follow the base of each tooth to remove the plaque. And then you just do that for all of your teeth and through the remainder of the wire. Awesome. So your daily oral care routine routine, the steps do matter, like which order you do it. It is recommended to floss first because you get all that plaque loosened in your
Mhm.
mouth, and then once you brush it, it gets rid of all of it.
Okay.
It's important that when you do your daily brushing twice a day, you don't just put the toothbrush flat on your teeth, you keep it at a 45-degree angle. And for you specifically, it's going to mean a lot to focus on that retainer area. Mouthwash, it's recommended you don't do it when you're brushing or flossing, just at a different time during the day. I like to do it after I've had lunch. You know, a mid-afternoon freshen up, that's good. And that, yeah, it's supposed to be at a different time because otherwise you remove all the benefits from mouthwashing. And some extra things that some people like to keep in their daily habits, which might be really effective for you, is tongue scraping. And in terms of important reminders, I know that you haven't been able to see a dentist for a while because of insurance changes and your job schedule. But it is really important to see that dentist every 6 months and ongoing, like to build your dental health back up. You might help to see them every 3 months for a little while, but they'll have you on an auto scheduler and we can help find you a dentist today. Also, keep your dentist informed about your heart condition and the fact that you've had infective endocarditis. They can order prophylactic antibiotics if need be for any major surgery or if they're doing any procedure where they could make your gums bleed. Alright.
Okay.
Just some prevention and follow-up care. You're supposed to floss every day. I'm sure you've heard it a million times, but it's really important with your condition to do that. The daily twice brushing, every 6 months dental visit, and it's important to avoid tobacco and sugary snacks and drinks. There's some warning signs to watch for that I'm sure they went over when discussing your infective endocarditis, but things that you might want to look out for that you would have to go visit an ER for is having fever, night sweats, body aches, or gum bleeding. Alright, so I'm just going to ask a quick follow-up question just to see if you understood the information we went over today. Which teaching